Welcome everybody. So today our guest speaker is Dr. Ahlfors. He's an assistant professor in the radiology department at Harvard Medical School, also at Massachusetts General Hospital. Dr. Ahlfors has a PhD in technical physics and biomedical engineering from the Helsinki University of Technology, and he did his postdoc at Albert Einstein College of Medicine. His interests are multimodal imaging, including MEG, EEG, structural and high. And today he is going to be speaking about complementary properties of MEG and EEG. Thank you very much.
Thank you very much, and thank you for inviting me here. And I guess this topic is such that I assume we can have like a conversation, and please free to interrupt me anytime when we're talking about the differences and differential aspect of MEG and EEG. And here is kind of a motivation. This is a piece of old data that's been puzzling me for a long time. There are simultaneously recorded MEG channels from a visual attention experiment, checkerboard patterns. The subject was counting the target stimuli, and then one shows now response to the target, and the other way with the standard response. And if you look at this, EEG and MEG both have a nice big visual evoked response in the back of the head. If we set the scale so that the visual responses are about the same scale, the huge P300 response in EEG was barely visible in the MEG, and it was clearly there, and you could see it when in EEG you could see like a big P300 in the middle of the head. In MEG you see many different things around the head, and so there are clearly differences between these. Just say something about multimodal imaging. Different steps. We have the black box here, the brain activation that we are interested in, and the next step would go from what is the actual signal source that we are able to detect, and then different central modalities, and then there's the analysis, reconstruction of the brain activity. And as an example, what would MEG, EEG, and fMRI, this diagram look like? That there's the signal source would be the blood oxygenation level as opposed to electrical current. Specifically the so-called primary currents that can be considered as the model for EEG, MEG sources. And now when we talk about, basically I like to use the word complementary information in this case, that we have complementary information about the same phenomenon. So for MEG and EEG we have information about the primary currents, actually the same primary currents directly. Whereas when comparing fMRI versus MEG-EEG, we have to go deeper back. It's like okay, we assume that there's some common brain activation, but where the signal comes is already a different. And so, for modeling purposes, you have to go kind of lower level modeling to get how does the activation is reflected in the whole contrast versus primary current. And that, in that sense, when you try to merge these methods, in the sense, that makes it merging MEG and EEG much simpler than merging MEG and fMRI. But today's topic is comparing MEG and EEG. And I have this going to put a rather elaborate diagram here that I think kind of trying to put everything about the world according to MEG and EEG, or the modeling. So kind of the same as previous slide. We start with the neural activity here, the primary currents in this case, then we record signals outside the head or on the scalp, and then we try to figure out what's going on inside the head from the sources. And conceptually, so the terminology here is the forward model is going from the primary currents to the signals, and then the inverse model is going from the signals to the source estimate. And I guess the first step would, or the third step would be the validation if we actually try to compare how are our source estimates related to the actual brain activity. And then just a comment that the forward model is quite different from the inverse model in the sense that forward model is a question of physics and geometry and set properties, whereas inverse model is more of a statistics and signal processing and estimation theory. And we add more to this already physical. So from modeling point of view, we can try to model the neural circuits there in the cell level, and that's one interest. Then there are all the issues of data acquisition and pre-processing, and also once we get our source estimate, we can do post-processing. We can then to the source estimates, we can do time frequency analysis or connectivity analysis or all that stuff. And so now the question is that in this picture, what are the differences between MEG and EEG? And let's start going there clockwise from the top. So in terms of neural activity, primary currents, the same. MEG-EEG, we can conceptually have exactly the same primary current, usually described as a small activity within a small area of the cortex would be represented a current dipole. And then distributed sources, you can have lots of little current dipoles spread out over the cortical surface, and that would be exactly the same for MEG and EEG. So no real difference is there. The validation part, I guess how you do the validation would be to compare with some independent information about the brain activity, fMRI data, intracranial recordings. In principle, the comparison would be the same for MEG and EEG, but in practice, there's the important difference that usually EEG is easier to record with other methods than MEG. So easier, I'm not saying it's easy, but say you can record EEG with fMRI simultaneously, or you can do EEG with EMS, transcranial magnetic stimulation simultaneously, or you can do intracranial recordings and scalp EEG at the same time. Whereas it's not easy with MEG to do the same thing. But on the other hand, you can record EEG and MEG simultaneously. And that provides the link also then to link MEG with the other techniques. And so that. Well, the inverse modeling, I would say again the same for EEG and MEG. No difference is there. The same inverse methods can be applied to EEG, MEG data. Same like connectivity measures and post-processing measures to MEG data. So that's it. So this is really what's left now, and this is my main topic today. And even only actually not even all of this. Just a comment on the data acquisition and pre-processing. There are of course obvious differences, the practical differences. MEG, you must just stick the head in and start recording. EEG, you have to put the electrodes in, all that. Messier in that. There are different types of artifacts. Some are similar artifacts, some are different. There are eye blinks, cardiac signals. But if there's a truck driving by outside the MEG lab, you usually see it in the MEG, but not. Well, you may see it in the MEG, but not in the EEG. There are specific artifacts that are specific modalities. And so now about the forward modeling, we split that one also in two parts. So, what's the fancy name? Synthesis and analysis. That's kind of the synthesis part is so actually constructing the forward model. That's a field of its own, and that's very important. And that you take into account the head model and thickness of the skull and holes in the skull and all that, and then construct the forward model of the head and the sensors and the yeah. And in general, as a general comment, I guess that MEG is it's easier for MEG than EEG to construct a forward model. It's easier in the sense that MEG is less sensitive to inaccurately known properties of the head. I guess that's one thing. And also there's a different properties for the head, the sensor position errors. It's usually nowadays the MEG systems you have a helmet and they are all fixed helmets, and you know the locations of the sensors with respect to each other quite accurately. But the head can move inside the helmet during the recording. Whereas in EEG, every time you put from session to session, the electrodes are slightly different locations, and you have maybe some digitization error in the electrode locations when you determine. But during the recording, they move with the head, so they don't vary during the head. So there's one particular difference between MEG and EEG. But then, what I'm really now going to talk and interested is the sensitivity patterns, so that assuming that you have constructed a good forward model, forward solution, and analyzing that, analyzing the forward solution, what are the differences there, like major differences between MEG and EEG, and usually the terminology, or you can think in terms of lead fields, which is describes the sensitivity pattern of a sensor. So it's a single MEG sensor, then you plot the sensitivity field or sensitivity pattern, that's called the lead field. But how sensitive is the dipole in one position or in the other position, another position, and you get that from the forward solution. In matrix terms, usually it's like the columns versus rows of the forward matrices, lead field or versus the dipole. And regarding the sensitivity, there are many studies now showing, for example, epilepsy data, epileptic spikes, that MEG and EEG see different things. That here is one study from our center, from Martino's center there, Anna Knacket, Steve Tappelgrim, and others who studied the 70 patients seeing at simultaneous MEG and EEG. And in most cases, in 39 cases out of the 67, not 70. Okay, well, anyway, most cases you could see the epileptic spikes in both MEG and EEG. There's 1/4 of the cases you couldn't see either of them. But then there were cases in both ways that you saw spikes in only one but not the other. Some in MEG but not in EEG, and some in EEG and not in MEG. So there's something different in the sensitivity. And I'm going to look at it now in terms of different types of source patterns. Let's say you have focal sources like big dipoles in the brain, or you have extended sources like patches of cortex that are activated, or the final one is what if you have just multiple locations, which I guess is typical for cognitive studies and all that. So you have many locations in the large scale parts active simultaneously. And for focal sources, for dipole sources, there's well known that there are two main things: the depth and orientation. That one thing is the depth, that MEG, or I would say E is less insensitive to deep sources. So both are more sensitive to superficial sources than deep sources, but say here is one curve for relative sensitivity to EEG, and here is MEG as a function of depth. This is a model in the spherical hair model. This is the bike up and then forward. Essentially, yes. 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 So you have a dipole of unit magnitude or the same dipole or constant magnitude and move it deeper or more superficial. How big is the maximum signal that you detect? And so the point is that both come down quite quickly as a function of depth, but MEG goes to actual zero at the center of the sphere, whereas EEG does not. So that's one of the things when people talk about deep sources, that MEG is not good for deep sources and EEG is basic. So, and here is another plot of similar data showing the kind of the simulated signal to noise ratio as a function of location. And again, here, especially in the medial circuit, it's quite obvious that MEG, you have a high signal in the superficial sources, and then it drops down quickly for deep ones, whereas in EEG, it drops down actually quite, goes much deeper here, and it's a different pattern. The other thing is the stripes pattern here, that's related to the orientation. Here it's assumed that the sources are perpendicular to the cortical surface, and when you have cortical surfaces, you have the source orientation. And this is the main thing about the orientation is that, again, well known for a long time, even longer than this, but this is a nice plotting of Cohen and Lukaku's papers about that the MEG cannot see radially oriented sources. And then if you plot the sensitivity patterns, the lead fields for MEG, they are always tangential, whereas for EEG, they can radial or tangential. So those are the two basic things, orientation for focal sources. One question is now that this strictly through the insensitive to radial sources, it's actually true for spherical head model. What about if you have a realistic shape set? So now you don't have exactly sphere, then you would expect that maybe in that case, I guess radial is not well defined, not even well defined what radial is. And then you may see something in MEG, and but you don't really. There is a simulation study. There's also some experimental studies by Philippe Melcher and Cohen and also Jens Howard actually recorded in animal models looking for realistic heads. They were looking for radial dipoles and boundary theories. And this is the simulation that we did calculating. If you take a location, any location in the brain, and assume now the three dipole components and calculate the best orientation at that location for EEG, and the worst orientation, and it turns out now that the ratio of the first versus best as a function of location is plotted here, and a histogram of those, so that for MEG the worst is pretty much close to zero for most of the locations in the brain. Whereas for EEG it's actually quite different, so that the worst orientation is still about 60%, gives a 60% magnitude of signal from the best orientation. And so this kind of means that yes, it's safe to say that MEG is insensitive to radial sources, even in a realistic head model. And this is another way of plotting similar data, so that we actually plot histograms of the three components there are two rather similar components and then one that is mostly zero. And that kind of can be that two tangential components. And they are similar sensitivity whereas in EEG, both three components. What about the extended sources? If you have a patch of activity instead of a focal point. And here are just some simulated field patterns. Okay, here you have a focal source, you have in MEG, this typical dipolar pattern, and in this case it's a tangential dipole, so you see in EEG also the tangential pattern, or this bipolar pattern in the focal field. And interesting that there's a tendency that if you start expanding the source, making bigger patches, this is quite big already, so 20 millimeter radius on the cortical surface. The MEG is still dipolar because it only sees tangential sources, so it always will look more or less dipolar. But there's tendency for EEG starting to look like there's a radial source. And so I'm interested to look at more into this. And actually, this is another study from the Ahlfors, and some of them asked for comparing the relative signal-to-noise rates, also again simulated data for EEG versus MEG as a function of the size of the source area. So, and if you have dipole sources, and now yellow means that it's better SNR in this, with these assumptions for the specific assumptions for the background noise. For the it looks like the better SNR for MEG for superficial sources, and better, the blue is better for EEG. So start expanding the sources, it starts to favor EEG more and more, except certain areas here. So what's going on here now? Why it's obvious, but and then this is one way to express it, how Epileptic put it so that the source frame for EEG is kind of the gyral frame. If you have extended sources, widespread sources, the sulci disappear, and you just have that. Whereas MEG, the sulci are essential, so you can't. And we try to quantify this down. Okay, just conceptually, what happens? So if you have a radial source like this on the gyrus, visible only to EEG, and this would be tangential for both MEG and EEG. You have a distributed or extended patch here, assuming that there's a uniform activation here. What will happen is that you have opposing dipoles on the Sulcal wall, that when you look from far, the signals cancel out, and specifically cancels out for the Sulcal sources, but not the gyral sources, or not on top of the gyra or the bottom of the gyra, which is the radial component in this case. So that could be now a difference in MEG, but obviously, and there's following as a signal cancellation also, that there's more cancellation of signal as a function of the radius of the patch. And then it's really not specific to the actual sensor structure. So we calculated in this case the blue and green here are for MEG magnetometers and MEG planar gradiometers. These are different things, but the results are much the same. It doesn't matter actually what that component of the magnetic field is. The signal cancels already because of the cortical folding rather than the sensors are. And So to actually get some numbers, okay, from the cortical patch, we divide or calculate the relative contribution of those source elements that are invisible to MEG, the radial component versus the tangential component, and how much those MEG invisible sources contribute to the EEG data. And here is a map for this specific radiality index. So the larger the number, the more radial the patch looks. This is for patches of 20 millimeter radius.
Can I ask a question? Like, so far, like, the main method is that the MEG is insensitive to radial sources, and also the EEG is also more sensitive. So the MEG is insensitive also to more extended sources, compared to the EEG. Then, but in one of your slides, like you indicate that in case of epileptic spikes, there's a huge portion or big portion that is detectable only by MEG but not EEG.
Yes.
So how is it explained?
So it has to do somehow with the available signal-to-noise ratio and the background activity. So I guess usually the signal-to-noise ratio, I guess, is determined also by the noise aspect. So the back, and then the major noise source is the background plane activity, unrelated to the epileptic. And now, because one way to think about it is because MEG sees less, it also sees less of the background plane. So the signal-to-noise ratio actually made for these focal sources may be visible in MEG where they are lost in the background activity.
Then instead of localization, what we care is like the localization accuracy. And so in this sense, like it seems that if the MEG in this case, like it has higher signal to noise ratio, this is what counts at the end, right?
Yes. In the extreme cases, as these epileptic spikes, you don't see anything in one case or the other. So your source localization results are not expected to be very good.
Correct.
You don't see anything. And so we compared this to another measure called cancellation index, and kind of just how much signal is lost, assuming that what if all the elements inside the patch would be activated separately, and you would add those up, so like the energy of those versus simultaneously when they cancel out. And it turns out that the map, there are similarities between the radiality index map for EEG and the cancellation index map for MEG, especially in terms of that they are the red on the lateral surface and this is the top view of the head. So this is the dorsal, the superior view. Whereas from the inferior view, ventral view, there is blue areas and also in the medial areas where there is less cancellation of the MEG signal. Also the EEG, the radiality index suggests that here in the medial and the ventral surface, the source is the expected orientation of the extended source would be tangential rather than straight. So yes, to just highlight the similarities here. By the map for the radiality index for MEG is all blue because she does not see the radial sources, so it always shows that tangential. Just make this is the cartoon picture. So after these cancel out, what is left is the the gyro and at the bottom of the sulcus, which are in this space, or you essentially from this kind of patch you would get the effective orientation of the dipole like this. And if you place this one into various parts of the brain, you can see that you can see that if this kind of small sulci on the lateral surface of the head here, or the lateral surface of the brain, the red arrows, the net red arrow here would be radial. Right here. Whereas if you are on the medial surface, the sources in the singular gyro, so whatever is there would cancel out, and the net effect is tangential. And the same thing here on the ventral surface, in fusiform gyrus area, or these areas. You actually, in MEG, you would actually see the gyral sources and not the sulcal sources. So, so this is like a qualitative, how to qualitatively understand the qualitative measure here, that the medial and ventral surface are different from the lateral surface. What happens if they add up? They would add up. Look like twice as big. So that's
possible. Not this type of analysis.
So this one assumes now that they are saying that when you have an extended area activated, it's all going the same way.
So they're all normal. They're all normal.
Right.
They all have other strengths.
Right. So that it would be like this, that one thing is pretty reasonable, that you can assume that they are perpendicular to the cortical surface, that they are here and here, because just for symmetry reasons, whatever is sideways, it will cancel out. There's no prepared orientation sideways. Whether this goes up or down, that can definitely, it can go definitely either way, up or down. And here it's always assumed now that you have extended area, it goes the same way for this modeling position, I suppose. I suppose, say, an example could be in a visual retinotopically organized area. You have a small stimulus or large visual stimulus. It will come to the cortex and activate the retinoid organized corresponding area the same way. So that without those kind of situations, I think that it's reasonable to assume that it's the same orientation or same direction for the current. But
there must go both ways. In another scenario, we have cancellation. Top one of them was face downwards, and you bring them closer together. They look very difficult.
yes, there are. Yeah, there are. The one thing is, if you have only on this side of the sulcus, usually the practical problem is that you have difficulties deciding which side. It may be difficult to decide which side of the sulcus it is, that side or that side, which would actually, if it would be just this dipole active at the time, and then we try to localize it, and we mislocalize it on this side. The orientation of the dipole usually you get reliably, so it would still point this way, but now in that case, it actually physiologically it would be the opposite orientation. We had a misinterpreted orientation. The tricky part also.
in a simulation, for example, you can assume that the two sources they like almost perfectly canceling each other. But in a real experiment, like in a real active condition, like you have, for example, median nerve stimulation, like we expect that even if we assume that there's any kind of activation in the motor cortex that will be perfectly aligned, S1 and M1?
Not perfectly aligned, but sounds good. They
Because
would
like
be just partially aligned.
because like from what I know in the literature, like there's at least when you get this kind of activation, most of the evidence indicates that one of these areas they're active but not the other.
Yeah.
So in which kind of case like do you expect this kind of activity that they cancel each other in this neurophysiological experiment? Like, give an example, like for example, like I tried to find out an example, but in an actual experiment, like you have this cancellation of two areas, they are next to each other, and both of them they are active, and they cancel each other. Can you think of any kind of this experiment?
One example maybe could be the visual cortex. Say you have a wide visual angle stimulus or large visual stimulus, and then in the calculating sulcus it would activate both sides of the calculating sulcus, or both hemispheres, so that you have left and right hemisphere in the medial surface. They would bilateral activation. That could be one. I could imagine, although don't really know the details very well, that the epileptic activity could also spread or start with the abnormal activity.
That's correct, but like so my objection in this case is that, for example, even if these one activities they are active, then even if we assume that the activity in the penis, for example, propagates, it propagates through some fiber, so it cannot reach the other side like at the same time. So there will be kind of
right. Yeah. This all assumes that it happens at the same time.
Yes,
There's no time here. So if it
there's a kind of like what I try to say that it's kind of a very so it's a very theoretical example, like or a theoretical approach, like in something that I don't know how frequently it will happen in an actual experiment.
Yeah, I agree that it's a kind of an extreme case.
Yes, exactly.
That in practice you would have just some statistical distribution, and it would not be all like that, and you get just the partial effect that you still get sometimes but you still get preferentially maybe in this case. You would still get like something like that you get more of one direction than even without the complete cancellation. Yeah, I agree with that. Actually, because you also understand, thinking about say some of these late cognitive potentials like the P300 or M400 responses that are not sure if they actually would be somehow uniformly active or if they're still just, even then there are multiple areas that contribute. But this is all like in the statistical sense. And then another example would be sleep data, that there are some CAS and NIMA and Interictal, they have reported some big differences between the MEG and EEG in the sleep data. So it may be possible that there are some widespread activity that could be understood. Here is more of the theory and slide here, but kind of summarizing now that what kind of basically people always say that what everybody knows about MEG and EEG is that the inverse problem is non-unique. and one way to think about the non-uniqueness is that there must be silent sources. So if you have two different current patterns, source patterns that produce exactly the same extracranial data, the difference of those two must produce zero signal output. So we can think about what kind of silent sources there might be in the brain. And then one thing is we can start with like a microscopic level that the closed source configuration by Lorente de Noor. There are open sources and closed sources that already, if the cell is, if you have a circular cell, stellate cell, there is no current dipole, there is nothing coming out from there. No far field from the so there's no EEG, no MEG. There's no primary current, there's no EEG or MEG. So there's a lot of brain activity that you just don't see at all. Then there can be the focal current. If you have single current dipole, then as we discussed, there can be certain orientations, the radial orientation, or if they are deep, then MEG won't see them, but EEG will see them. And then the number two here is the patches, the extended sources. There's this specific cancellation of Sulcal walls, assuming that there are more or less uniform on the opposite side of the zoo. And then you get the effective source orientation that depends now on the regional differences, whether it would be radial or maybe tangential. And I guess the last point that I haven't talked about yet would be just that if you have multiple sources around the brain, like separate areas, say that you might see, especially I guess in cognitive paradigms that you have lots of areas activated simultaneously. And then there would be, that's typically typical for MEG to dissociate multiple simultaneous sources. There is overlapping topographies and accidental cancellation of topography. But there also, particularly there, some combination of MEG and EEG might be useful. But here is just again simulated example that maybe not completely unrealistic. That what if you record an MEG signal, MEG topography that looks like this? So there are clearly these dipole patterns, and one possibility that, okay, here is one dipole, and here is another one, and you get two dipoles like this. Say if this is the back of the head, maybe you have a calcareous sulcus activation and parieto-occipital sulcus activation, and get this quadrupolar field pattern. But you could also see a dipole here and a dipole here. Maybe it's a bilateral activation. Dipole pointing this and so it's easy to come up with ambiguous topographies that kind of at least approximately can be explained by. If you actually do a dipole fit, you probably get the one for the simulated data, but then it's noisy data and there's no value. And in this particular case, if you record simultaneous EEG and you get a topography like this, that would immediately resolve the problem on, this looks like there's one dipole here and another dipole here. So this is likely to be, because this cannot be explained by these kind of dipoles. And so combining the techniques, combines quite powerful in these kind of things. And one example, that the visual cortical activation would be bilateral auditory cortex activation. There's historically, I believe that the N100 auditory evoked response in EEG showed a big negativity in the middle of the frontal cortex. And some time ago, people were puzzled and debating whether the frontal sources or whether they are the broad cortex sources. And I believe now I'm pretty sure that they are actually bilateral temporal auditory cortex sources that then they are pointed downwards, so they add up to a negativity in the middle of the head. And then you look at the MEG data, it's very different from MEG. You clearly resolve that, okay, the dipole is on one side and on the other side. And then there's radial frontal source would not explain MEG data. And interestingly also, at some point, I don't have a slide here now, but people were reporting that also for the auditory MM100, that looks like in the MEG, it looks like there's a variable source in the back. And it kind of happens if you ignore the bottom part here. This would be one half of the dipole in the auditory cortex there, and this would be the other half, or one half of the dipolar pattern from the right auditory cortex. And you look from the back, it looks like a dipole. And that has been also debated, and it's not completely clear now. There is also a parietal source, and it's a tricky thing here. That there's also with the, if you do two-dipole solution, it explains quite well. But if you distribute source, you do the minimum norm estimate. It likes to spread out the current. It may want to spread out current here, even though the two sources might be very close. So there are so summarize. There are complementary. One important difference or complementary aspect of MEG are these different sensitivity patterns and the implications. There's some different implications for whether the sources are actually focal, whether they are distributed or extended, or whether they are distributed. And it's pretty safe to say that combining these two data are beneficial and provide information that's not readily available for one modality.
So most of these conclusions, they come mostly from simulation data. And I was wondering whether you are aware of any kind of other kind of study that supports kind of things, like for example, phantom studies or any kind of studies from invasive simulations in epilepsy patients or surgical patients. But I know a couple of them, like in terms of source localization, but are you aware of any kind of these studies, like the study of orientation of the sources?
I'm not sure. So there are some of these own studies that people actually have implanted dipoles in similar animal studies or patients also, but they go and patient and putting a single dipole there. But conclusion there was that the localization accuracy was pretty much almost the same for a single dipole.
Something, for example, you see also simulation data. But for example, like this phantom paper.
That's right.
So he reports double, twice better localization for the MEG compared to the EEG for tangential source. So like,
right.
I try to find out what's the source of all these controversies in all these conclusions, like because some other stuff they report like different localization accuracies for the MEG, difference for the EEG. What is the study that you regard as more reliable?
I guess one of the difficulties here is that the solution depends on what kind of the accuracy depends on what kind of source distribution you have. If you have a single focal source, in either method, EEG and MEG, you can pretty accurately localize. But as soon as you have multiple sources, you have extended sources, it's becomes kind of specific now in the case that it may be like there may be something funny going on in a specific case that it actually becomes ambiguous, and then you may get completely wrong solution. Like you may get this if this is the true solution, and then it's way off. And then so in some sense I'm not too worried about whether you can localize double with 6 millimeter or 7 millimeter precision, because you may because in some cases you may go or you may miss something. So often it's specific to the particular pattern of activation or simultaneous activation. In cognitive studies, I guess it helps if you can somehow dissociate that some subtraction conditions or something that you can try to, as much as possible, just have a small number of areas active at the same time by manipulating experiments. Patient data.
We can